Hello, I am Peter Okwocha. Welcome to Focus on Africa, our top stories. As the number of people infected around the world rises to nearly 2,200,000, China reports a 50% rise in the official number of deaths linked to coronavirus in the city of Wuhan, where the outbreak began. Egypt overtakes South Africa with the highest number of confirmed corona cases in Africa. We'll round up the latest news from across the continent. We'll also take a closer look at Zimbabwe, where it's feared coronavirus could put an unbearable stress on already stretched food and medical services. And keeping safe in body and mind, we'll talk to a psychiatrist about the importance of building mental resilience during lockdown. Thanks for joining us here on Focus on Africa from BBC World News. China has reported a 50% increase in the number of people who have died after testing positive for COVID-19 in Wuhan, the city where the virus originated. The total number of confirmed deaths in China is now over 4,500, a rise of more than 1,200. News of the amended death toll came shortly after state media reported China's economy had contracted by a substantial 6.8%, the first contraction there for 30 years. The authorities in China have denied there is a cover-up, but here's the BBC's Steve McDonnell.
Now, what officials are saying is that what they've been able to do is use the time they now have, because the crisis is now under control, to have another look at the numbers. And they're counting people who've, for example, not come into hospital, maybe who've died at home, or maybe people who've died with symptoms they're pretty sure are coronavirus symptoms, but haven't officially done the test. There's been a lot of criticism, a lot of questioning regarding China's figures, people suggesting that they've potentially been underreported. I'm not sure if it's come in response to that, but either way, it is a big jump in one day, just like whack, up by 50% there. Still, though, when you consider the numbers in other countries, it seems remarkably small.
Meanwhile, French President Emmanuel Macron has joined US President Donald Trump in those questioning China's handling of the outbreak. According to Mr. Macron, it is naive to suggest China had dealt better with the crisis, adding that things happened that we don't know about. China has dismissed any insinuations of a cover-up. Here's a look at today's up-to-date figures from the tracker at the Johns Hopkins University. The global number of confirmed cases is now over 2.173 million. In Africa, Egypt has now surpassed South Africa as the country with the highest number of people infected with the virus. That now stands at more than 2,800 cases. The United Nations is predicting that as many as 300,000 people could die in the pandemic in Africa. Although there are fewer than 20,000 confirmed cases at the moment, the World Health Organization says as many as 10 million of the continent's 1.3 billion population could become infected in the coming months. But agencies are urging people to observe whatever restrictions their governments have put in place as the virus starts to spread away from African capitals. Here's a roundup of the latest developments on the continent, starting with Nomsa Maseko in Johannesburg.
The biggest threat to South Africa's extended coronavirus lockdown is food security. In some places in the country, looting of supermarkets and protests have already been reported because people are without food. There are also fears that these protests could also escalate to other places in the country if people are not fed. The government and a number of NGOs have been putting together food parcels and delivering them to those who cannot fend for themselves.
Locally transmitted COVID-19 cases are slowly increasing here in South Africa. But there's some good news. Nearly 1,000 coronavirus patients have recovered.
Botswana has recorded less than 20 COVID-19 cases, and the country's president, Mokgweetsi Masisi, and his cabinet have pledged 10% of their salaries towards the COVID-19 relief fund for the next 6 months.
Massive job cuts are imminent in Zimbabwe because of the coronavirus outbreak. Up to 25% of formal jobs could be lost as a result of the stagnant economy.
Now to Charles Mbolo in Lagos, Nigeria, where the government has threatened to close private hospitals who are secretly treating COVID-19 patients.
That's right, Nomsa. This is an issue that has been raised a few times during the daily presidential task force briefings. These hospitals have been warned that secretly treating a positive coronavirus case could be dangerous for health staff and other patients. The government has now said it will close down private clinics, ignoring its advice if people with money continue to seek private care instead of going through the official protocol of contacting the Center for Disease Control. So far, the country has recorded 442 cases with 13 deaths, including 2 doctors, the first healthcare deaths to be reported. But the National Human Rights Commission here says security forces have killed more people than coronavirus. 18 people have so far died during clashes with law enforcement while trying to enforce lockdowns. In Senegal, 7 new COVID-19 cases have been recorded, bringing the total to 342. Senegalese Minister of Health, Abdoulaye Diouf Sarr, urged people to remain cautious and wear masks in public places as the country records more and more cases with unknown sources of infection. In Ghana, government has extended lockdown on the country's 2 main regions for 1 more week. President Akufo-Addo said the Ghanaian government would absorb electricity bills of the poorest citizens and 50% of other residents and businesses for 3 months to ease the pain. The country currently has over 300 cases of the virus with 8 deaths. So far, the West African sub-region has more than 4,200 cases of COVID-19 with over 60 deaths. And now to Nairobi, where Ferdinand Omondi has more on the planned rollout of weekly stipends for the poor in Kenya.
Thank you, Charles. Here in Kenya, the word stipend is generating more and more debate. Yesterday, President Uhuru Kenyatta announced an additional $80 million for the poor and the needy under the cash transfer program. He also announced that families here in Nairobi have already been identified and will start receiving weekly stipends. However, what was not clear is how these families were identified or how much money they will be receiving. It is likely they will get direct cash transfers, as the minister pointed out that some of the agencies which were mandated to be distributing these government reliefs have been pocketing at least half of the funds. In Uganda, there has been widespread outrage after members of parliament awarded themselves about $3 million for the supervision and advocacy of COVID-19. At least one member of parliament, the musician Bobby Wine, criticized that move as selfish and insensitive and promised to wire that money back as soon as he gets it. Uganda is in the middle of a countrywide lockdown and thousands are in need of food aid. But the government extended that lockdown by another 21 days, which could mean more job losses and more outstretched hands. In Tanzania, it is 1 day since President Magufuli announced 3 days of national prayers against the spread of COVID-19. Learning institutions remain closed in Tanzania, but churches, roads, pubs and markets remain open as the government has resisted shutdowns and lockdowns which many of the neighbors have enforced. This week, Tanzania announced a sudden spike in its confirmed cases, and many will be watching how those numbers pan out in the coming days.
Ferdinand Omondi there in Nairobi. Well, Zimbabwe has one of the lowest numbers of reported cases of the coronavirus on the continent. It stands at just 24, but there are questions over if this figure is an accurate reflection of the presence of the virus. There's also a warning about the impact the outbreak could have on the country's already stretched food resources, as well as an economy projected to shrink by 7.4% this year. Shingai Nyoka has more.
Even in the time of a highly infectious disease, there are pressing needs for food. There's a maize meal shortage here and people are taking risks to get it. COVID-19 has arrived at the worst possible time, during a drought and economic collapse.
So you know what is happening. When people hear that there is some maize meal at the shopping center, they all rush and forget about all these health protocols, all the corona issues, simply because there's tension. They're torn between survival and a threat that is invisible.
The government is also trying to strike a balance to keep a fragile economy ticking, and it's gradually eased lockdown restrictions. The food markets have opened again, but most people are potentially still vulnerable to the coronavirus here, where social distancing remains a luxury. And so too are gloves and masks, which have grown in price almost fivefold since the outbreak began, more than most people here can afford. But the vendors are happy that they can make a living despite the risks.
It's much better to come here to work for gain something than to stay at home, because our situation here is not good.
COVID has brought death here, but also a silver lining. It's forced government to rehabilitate long-neglected public hospitals. And the private sector is chipping in too. Through donations, several hospitals like this church-owned facility will reopen to treat critical COVID cases.
We're praying as well as trying to put our efforts together so that we are a little ready, in as much as we want to be more than what we can do, but we're just doing the little that we can do.
Dr. Clemens Chidziva will be leading their response.
It's very difficult for us to be able to know where exactly we are. Are we at the beginning of the curve? Are we where we are on the curve? We really can't tell.
As of last weekend, Zimbabwe had tested just over 600 people, one of Africa's lowest testing rates. There are plans to ramp up to 1,000 tests a day. But with still many unknowns, there's no clear indication whether the country is winning the battle. Shingai Nyoka, BBC News, Harare.
Well, let's delve deeper into the situation in Zimbabwe now. I can speak to Norman Matara, a doctor and a human rights activist who joins me from Chinhoyi. Norman, on certain days ahead for Zimbabwe, given coronavirus, the food shortages, as well as a shrinking economy, what's the priority for the government?
Well, the priority at the moment is to actually prevent this virus from getting into a full-blown outbreak. You know, we have got a very weak health system, and we cannot contain an outbreak of coronavirus at the moment. So the major priority at the moment is to put in place structures and protocols to make sure that we really do not get a full-blown outbreak, because our hospitals, our health system has already been stretched thin, and we cannot be able to respond to an increase in the number of cases.
I know we're only reporting 17 COVID-19 cases across the country. I mean, how reliable is this number, given the fact that there have been very little tests carried out?
Yes, as of yesterday, the number had increased to 24 positive cases, actually. The number is still very low, but we do not think that this is a true representation of the situation at the ground, because we have carried very, very little tests in the country, and we might be missing further positive cases in the country. So the ministry has promised that they are going to roll out an intensive screening program and testing program throughout the country, and only if they start doing that, then we'll get a true representation of the positive cases in the country.
And Norman, the attitude of you and some of your colleagues in the medical profession is not helping matters either. I mean, some accuse you of being at work one week and being on strike the next at a time of such a serious pandemic.
Yeah, the public have actually to bear with the health workers because at the moment we actually do not have adequate personal protective equipment, and what we are doing right now is to work with the little resources that we have. People cannot go to work and put themselves at risk. So what we are doing right now is that those people, we are just working with the little resources that we have. So not everyone has to go to work every day. We'll allocate maybe one person to go and cover the department because there is no personal protective equipment.
Do you think, Norman, that the government is taking your plight seriously and the government is doing all it can to provide these PPEs?
definitely the government have not taken our plight quite seriously, because since this pandemic broke out, we only learned that even the Minister of Finance had not released money to the Minister of Health to get this PPE. They only released the money this week. That's why we as doctors, we took the government to court last week to put more pressure on them to be more serious and provide PPE to all the health workers.
Okay, Norman Matara, a Zimbabwean doctor and human rights activist, speaking to me there live on Focus in Africa. Thank you very much. And you're watching Focus in Africa from BBC World News. I am Peter Okwache. Stay with us and we'll have more on coronavirus and how it's affecting countries around the world. But we're also interested in hearing what you have to say about living life under this pandemic. If you have any questions you'd like us to answer, please send us a short WhatsApp video, 30 seconds maximum, to +44 7521 665 106. Tell us what you're doing during the lockdown and how it's affecting you personally. That WhatsApp number again is +44 7521 665 106. Thank you very much. I'm Peter Okwache. Welcome back. Now, it's Easter weekend for Orthodox Christians across the globe. In Ethiopia, Africa's second most populous nation, the holiday comes amid efforts by authorities to enforce restrictions put in place to combat the pandemic, such as banning large gatherings. But many people seem to be ignoring the warnings as they get ready for the celebrations. Kalkidan Yebeltal sent us this report from Addis Ababa.
Millions of Christians in Ethiopia are preparing to celebrate Easter. Normally a time to rejoice and a time for festivities, but these are not normal times. A state of emergency has been declared earlier this month aimed at restraining the spread of the deadly coronavirus pandemic, and the decree bans religious congregations. As a result, a number of Orthodox churches here in the capital Addis Ababa have closed their doors on the faithful, something unprecedented in the Holy Week. But the state of emergency also bans gatherings of more than 4 people, and that has been particularly difficult to enforce, especially in markets ahead of the main holiday on Sunday. Open markets in Addis Ababa are seen crowded, and it's not all vendors and shoppers that are practicing social distancing or wearing masks. Authorities have moved one of the biggest farmers' markets in the city to a more spacious area, hoping to encourage people to keep distances amongst them, but that doesn't always happen. Traditionally, Easter is celebrated by slaughtering goats or sheep at home, and there is a custom of eating raw meats that health officials are advising against. The number of confirmed COVID-19 cases here in Ethiopia is relatively low, but increasing complacency means things might take turn to the worse in the coming weeks. Kalkida Nibeltal, BBC News, Addis Ababa.
The Human Rights Defenders Coalition in Malawi says it has won a 7-day injunction against a lockdown which was scheduled to start on Saturday as a measure to stop the spread of coronavirus. There had been angry protests against the government's plan earlier today in the city of Blantyre. The HRDC says the livelihoods of the most vulnerable workers, including informal traders and sex workers, would be seriously affected by the planned 3-week lockdown. Now, it's still not clear what the effects and impact of COVID-19 will have on people's mental health around the world on the short and long term. But it's more than likely that the difficult times that we're all living under will linger on in the mind long after infections are wiped out. Life under lockdown and self-isolation can be particularly hard for people already struggling with mental health problems, as well as people facing job losses or separation from their families. To talk about this and more, I'm joined by psychiatrist Lukoye Atwoli, who's involved in mental health advocacy, and he joins me from Nairobi. Thanks for talking to us. What are the main issues you foresee in a post-COVID-19 world?
So for most people in the world, this pandemic is going to change how they see life, how they see interactions, and how they think about hygiene. And for many people, how we have try to control the pandemic, the steps that have been taken, which include reducing social interaction and discouraging the human touch, will have lasting mental health consequences for most people. Because as we know, the human interaction, where there is touch and where people come together and talk to each other, is a core part of who we are as human beings. And restricting that is going to definitely change how we think, how we feel, and how we behave.
A vast majority of the globe is living under these restrictions now. So who are the most vulnerable groups within all of us?
So there are already people who are initially vulnerable to mental illness, or they already have mental illness. These people are going to suffer a lot more, partly because those who need services will have some service disruptions, but also because this pandemic increases the risk of mental illness anyway. And the second category of people who will be significantly affected are people who have other chronic physical conditions, who will start getting a lot more distress, might get more anxious, and might end up having mental health consequences as well. Other people who will be affected are people who will lose a livelihood, people who will come from a place where they were comfortable and find themselves below the poverty line because of the effects of this pandemic, and they are at high risk of developing mental health problems as well. There is an increase in sexual and gender...
Can these effects be mitigated? How can they be mitigated?
Yeah, so they can be mitigated partly by actions of government, where they try to reduce the socioeconomic impact of this pandemic, but also by ensuring continuing services during this pandemic so that the COVID response doesn't take over the entire health sector. And thirdly, by giving people information about self-care while they're in isolation, while they're in quarantine. People need to know that they can enter a routine, they can take care of themselves, they can take their minds off COVID-19 and think about life after COVID-19 and plan for that life. And this will reduce the anxiety that comes with living under a pandemic.
And Lukoya, you and I both know that on the African continent, these solutions are easier said than done. Do you think governments on the continent take mental health seriously enough?
So traditionally, they haven't taken mental health seriously at all. In fact, they have hardly taken health seriously, despite having meetings where they decided that 15% of their budgets will be spent on health in their Abuja declaration. So this pandemic is a wake-up call to our African governments to think more seriously about health, and in fact, much more seriously about mental health, if we are going to come out of this pandemic with a population that is productive and healthy.
And so Lukoya, just before, we're running out of time, but I want to bring in the frontline workers, people in the medical sector. I mean, they have to be taken care of specifically as well, don't they?
Yes, so every response, every effort that is being made by governments across the continent and across the world must include a mental health and psychosocial support component for staff, for their frontline health workers. They need daily debriefing. They need access to someone with mental health expertise when they feel distressed. They need to have somebody that they can talk to when they break down, because this work is back-breaking. This work is completely tiring for all the health workers on the front line, and the risk they face every day increases their challenges with mental health. So it is important to have that response as well.
Lukoya Atwoli, thank you very much for your input into this very important topic. Thank you very much. Now, don't forget, you can get in touch with me and some of the team on social media. I'm at Okwoche. But for now, from Focus on Africa and me, Peter Okwoche, thanks for watching. Have a great weekend. Goodbye.